Our ER begins here at the entrance where any patient who is a walk-in would come through. They would go straight to nurses in reception, where nurses would either send them to a room or send their family to a waiting room. By the waiting rooms, we have 2 bathrooms for family use. Then we have the non-emergent rooms and the urgent rooms, an ER exit to the hospital, labs and testing, the ambulance bay, OR2, a supply closet, emergent rooms, another entrance that comes from the helipad, radiology, OR1, another supply closet, and the nurses' stations, reception, and triage centrally located throughout the whole ER.
For our ER project, we created JS Memorial Hospital, and it's presented by me, Catherine, Sam, and Sierra. One of the main problems we focused on was understaffing, and in order to solve this issue, we decided to hire more nurses and doctors. Nurses will make approximately $41.67 an hour, and doctors $113.60 an hour. Employee and benefits include paying nurses for schooling, pay off students' loans in return for work, and holiday pay. Another main problem with the ER is shortage of supplies, and to prevent this, we decided to add 2 supply stations within the space. This will allow for more storage of supplies, preventing a shortage of on-hand materials when they are needed. More so, we added a centrally located supplies. Between the nurses' station is a supply station which would contain medications, bandaging supplies, blood, etc. that all staff can access at any time without having to go to another area of the hospital or wait for everyone to access the same one. There also will be ER exclusive supplies. A common problem among ER is lack of supplies or immediate availability, which is why we have designed the ER to have its own supply locations and stock of supplies and its own radiology and lab center. Another main emergency room problem is communication. To solve this problem, we have centralized nursing stations that are organized by reception and triage. This will allow patients coming in on their own to see the reception/triage desk first, rather than have to use the same station as the emergent patients coming in through the ambulance bay or helipad. For the waiting room, we have it so that it allows patients' families to be close by so that they can get updates and communicate with doctors and nurses quicker than if they were in a different area of the hospital. And we also have readily available supplies in the ORs. This will prevent miscommunication regarding supplies that are needed to treat a patient, as well as which patients need to be moved to an OR, because both supplies and operating rooms are in the ER and available for immediate use if needed. Our 4th problem would be organization of space. Separating patients that have more serious injuries and the ones with less serious injuries by putting them in different color rooms, red being emergent, orange urgent, and yellow non-emergent. Reception desk by regular entrance so patients can check in and be triaged. Ambulance bay and entrance needs to be separate and on opposite ends to prevent traffic and paramedics from being able to get through. Urgent supply center in the middle of the emergency room for easy access, and 2 nurse stations that are centralized and divided into reception and triage. The last problem we are focusing on is the test results being expedited. Radiology and testing lab are separated, helping to divide the workload of the patients who need testing. Tests will be ordered only if the patient needs them, since unnecessary tests lead to overcrowding in the labs.
So our first patient was hit by a car while walking on the sidewalk, and they complained they had trouble moving from the waist down and they could not get up. So first this patient would come through the ambulance bay and then triage to an orange urgent room. Once they're in the room, the nurse and doctors would take their vital signs and diagnose. The patient would most likely go to radiology for an x-ray to check their spine. They would go back to their room, and based on the doctor's diagnosis, would either go into surgery in an OR in the hospital, which would not be the OR in the emergency room. Our second patient was in a multiple car pileup on the freeway. Medevac was dispatched and the patient was flown to the hospital.
Go.
They have a head injury and there's a lot of blood. So they would come through the helipad, since they are flown from the accident, and they will be put in the emergent red room in that triage category. The doctors would quickly take vitals and diagnose, and then rush them to the rush them to the operating room in the emergency room since it is apparent that they have a traumatic brain injury.